You are listening to I Am Refocused Radio with your host, Shamaya Reed. This show is designed to inspire you to live your purpose and regain your focus. And now, here's your host, Shamaya Reed.
Welcome to I Am Refocused Radio. Once again, we are here today, and just like any other time, we have another show lined for y'all today. We have the true honor talking to Dr. Rhonda Hodge. She is a psychology alumna and founder of Harmony Psychiatric Services. She combines medication management with exercise and nutrition in an innovative approach to treating the symptoms of mental illness. If you're watching this online, we're going to have her information on the ticker tape. If you're listening to us on radio, we'll have it in the show notes. First and foremost, I want to welcome to the show and say, how are you doing today?
I'm great. Thank you so much for having me. I appreciate it.
I appreciate you being on. So first and foremost, kind of tell us a little bit about your career. What inspires you to pursue it?
So I started my career as a therapist. I graduated pretty quick, and I became a therapist when I was about 21, 22. I would say about I'm watching some kiddos coming into therapy. They were having trouble like holding their heads up because they were so over medicated, and it really pulled me towards the medicine side. So I sort of made a switch, and I'm now board certified in psychiatric mental health nurse practitioner and psychiatric family nurse practitioner. So I did some primary care for a while too, and some urgent care.
You froze.
Oh no, you did too.
Okay. If you could just finish your thought when you just gave a little background of your professional, because it kind of stopped. I was like,
okay. Do you want me to start over?
Yeah, I can. It'll be edited.
Yeah, that's fine. Okay, sure. So I graduated with my master's degree in counseling when I was about 21 or 22, and I started working as a therapist pretty young and started teaching pretty young, which I think has given me a lot of perspective. I was probably a little too young for that. But probably about, 6, 7, 8 years in, I started seeing a lot of patients coming in, especially this one little had to hold up her head because she was so over medicated that I really got pulled towards the medicine side of things, and journeyed through my education and became a psychiatric mental health nurse practitioner and a family nurse practitioner, and did family medicine, and then got my doctorate after that. So that's how I opened up Harmony, was really combining a lot of med appointments are just the medicine piece with lots of other factors. We look at pretty much the whole person. Every time they come into the practice, they know that is our goal. So yeah.
When you look at someone's mental health journey, what does empowerment mean to you, and how you best serve them?
Mm-hmm. It means everything. During COVID, I started making videos just to be able to connect with the patients because we weren't able to connect with them physically. And empowerment was a big piece of that, and vulnerability too. Empowerment and vulnerability. You can stay alive and not be empowered, but we really want our patients to thrive, and that empowerment piece is huge. And not feeling judged and feeling seen, and then being able to actually look in the mirror and see yourself, that's like true empowerment. When my patients come in, I really hope, and I have heard this, that they know that they're a part of a family and that we absolutely love them. And that's a part of that empowerment, to know that they're not being judged because they're walking in the door, and to leave feeling like they're equal and it's okay to be struggling.
When you think about innovation, that and holistic care is becoming popular with your practice. What do you see benefits integrating exercise and nutrition, because a lot of other practices, sometimes they focus solely on medication?
I think it's huge. That was actually, I did my doctorate on exercise and nutrition and compared that to just the basic depression scales, and actually saw some of my patients who were doing the nutrition and exercise plan that was a part of the research were able their scores improved. Moving your body, it gives you a dopamine kick. It helps with that feeling good about yourself. Part of depression and anxiety is not being able to move and not feeling stuck and feeling frozen. And that sense of accomplishment, even after going out for a 3-minute walk around a building, it can be huge. We have some like hiking groups we do with our patients. We do with some of the younger boys. We've done jogging where we're talking and we're moving our bodies and talking about why that's important. But also it takes a little bit of the stress off sometimes too for some of these kids, because they're moving their bodies and they're talking more. But we're doing so much more than that for sure.
Once again, listen to our Refocused Radio and watching us online, talking to our guest today, Dr. Rhonda Hodge. She's the founder of Harmony Psychiatric Services. Go to their website, harmonypsychiatric.com. The next question is, we talked moments ago about movement and how nutrition, exercise, that plays a role. How do you determine with your clients the balance between medication, nutrition, and also movement?
Through the relationship that we develop with our patients, this is something that I do with all my new providers that I'm training, is we talk about how important that relationship is, how important that piece is, so that if I have someone coming to me and I know that their kiddo's going to college and that's going to be really hard for them, they come and see me and they come and tell me that their anxiety is increasing. And if I didn't know all of these things about them, I might make a medication change. Instead, I'm able to sit with them and say, but you know what? You told me that Johnny was going to college next month and that's going to be really hard. Why don't we sit with those feelings instead of coming in, we make a med change and they actually were blanketing it with medicine instead of allowing them to grow. And that would be the same thing with exercise. We all have a background, whether it's as a family nurse practitioner or a psychiatric nurse practitioner, so we know what they're capable of too and what their bodies are capable of and helping them build, but also making sure it doesn't become an obsession so that it's not it's taking the place of something else. So it's just about finding that balance. But that all comes through like really loving and having that relationship with our patients so that we really, really know them.
When it comes to education and support, how do you equip your patients with the knowledge that they can use? Because a lot of times if we don't have the knowledge, then we don't exactly know how we're going to execute.
Mm-hmm. Yeah, that's funny. I tell my patients I'm always going to over-educate you. And sometimes I say that it might be at first, you might be like, Rhonda, stop talking. Like, I don't even know what you're saying. I'm like, but especially with my kids, I'm like, but when you're 18 or when you're 22 or 32 and you're going to look back and say, oh, right, Rhonda told me about that, because I'll repeat it over and over again so that they're getting the same message. And if it shifts, or their life shifts and that message isn't the same anymore, I make sure that I point that out too. That remember we talked about this. Well, this looks different now because of this, so that they really have an understanding about why they're doing things, which you bring up a great point. People aren't going to follow through if they don't know their why. That will only last for so long. So yeah, that was a great point.
I like what you said about later on in life, they're going to remember those nudges, if you will, because we need that. And we kind of need that almost accountability partner to kind of walk with us as we are doing what is going to be beneficial for us years to come. So when it comes to support systems and tools, what are some of the things that they can expect beyond the clinical setting to help them stay on track?
So we have a lot of things that are set up within Harmony. So one of the things that we did post-COVID, I talk about post-COVID a lot, is that for students and adults, there was like a missing piece essentially, where teachers were needing to be mental health providers and mental health providers were needing to be teachers. And there was just this big gap. So we actually have academic life executive functioning coaches, career coaches that have come in since then, because I say this all the time, we were like on the Titanic, just keeping people alive for a long time. And we wanted to help them to be able to start living again. And so we needed that extra support in the middle. And that is one of the ways where we're supporting people by helping them be accountable. There's an app that they can use with their coach to keep them, on point, that they can text them in between appointments, and they know the boundaries around that. And you're right, like that accountability piece is huge, especially when you're trying to combat something as heavy as like depression.
And sometimes people, like you said earlier, they don't move. And point of that can be due to fear, or sometimes all this mental, health issues can be a stigma for some people. So how do you kind of break through the noise, if you will? Because there's a lot of information online, but unless you actually work with someone like yourself, some people might be too afraid or embarrassed to acknowledge they need help.
Luckily, that is one of the things that I think has been helpful since COVID, is that people are getting help. And that has been pretty huge. I think it's really through love, and again, through the relationship piece, is for people that aren't at Harmony, to know that there are other providers out there that are doing this because they want to kind of walk with you on this journey. And that if you do find somebody, it takes a lot just to make that first phone call. If you don't find that person that you connect with as a therapist, it's okay. It's okay to walk away. Don't feel guilty about it. Don't feel bad. Move on. Like, we're used to sometimes, like, not everybody's going to click. Just not giving up on yourself, and knowing that at the end, once you're feeling better, you'll be able to find that love for yourself that maybe you're not feeling in the moment.
If someone's listening to us and watching us online, and they feel hesitant to speak up for themselves, maybe it's for whatever reason, what would you say to them based on your experience with other clients that will encourage them to take that step, even if they feel like, I don't know what's going to happen next? Because that's a legit question to have.
Yeah, and that's our job, to be the person on the other line that tells you what to expect. But sometimes, just honestly, logistically, even when you're feeling depressed, when you're feeling anxious, you can't even pick up the phone and call a pizza, like order a pizza. Like, you can't do anything. Having a friend do it for you. A lot of the online formats that, like, for example, we have purposefully for this reason, because it is so hard to make that phone call and it is so hard to choose yourself. And I, hands down, please choose yourself every single time. Is that there are those formats where you can just click on a website and you can put in your information and you can start the conversation that way. We have the ability to text. We have the ability, so many different ways, because we have had friends call and be with that person. Those blocks are so real, to be able to pick up the phone and allow yourself to be vulnerable in that way. There are so many ways to be able to figure that out. Just choose one, almost like when you're about to do something that's really, really scary, the top of a roller coaster, and you're about to go down, but you hold your breath. Just do it. Just really take a chance on yourself, because it's so worth it. I have seen people who have come to me in some of the darkest places, and I'm probably gonna start crying. It's really so cool to be able to watch them hold their head up and know that they made it, and say, oh my gosh, do you remember when I started seeing you 7 years ago and all of these things were going on? I couldn't imagine feeling this way now.
Once again, listen, Refocused Radio and watching us online, talking to our guest today, Dr. Rhonda Hodge, founder of Harmony Psychiatric Services. Go to their website, harmonypsychiatric.com. And speaking of dark places, that's a real feeling, experience that people have to battle day in, day out. When you look at innovation in the future of what your team is doing, what excites you, and what's some of the things that you hope will be not just benefit for your practice, but for people who are seeking additional help?
I would say one of the neatest things that I brought to the practice is TMS, and I didn't really know too much. So it has been around for a long time, but it's being used a lot more, and it's a non-pharmacological way to treat chronic depression and other things, OCD, anxiety, but mostly it's like treatment-resistant depression. And I was reluctant. I was nervous. I didn't totally understand the science behind it. Now I do, but I didn't really then, but I knew that I needed to do something because people just weren't getting better after COVID, just with medication and all of these different things that we were trying. I brought it to the practice. And when I tell you, I want to hand it out like candy, because I've seen people that I've been seeing since I told you I started when I was like 21. I have one person I've been seeing for that long, and she was 19, who now feels joy, who doesn't have those suicidal thoughts every day anymore, who is feeling like she might still need the medication, not at the dosages she did, but it's unbelievable. I've seen people that have started to take steps forward in their life where they felt stuck. They couldn't change jobs. They couldn't leave back poor relationships. They couldn't set boundaries. And it's like they're alive again. And I feel like there are going to be so many more treatments, and there are, that are, that everybody's talking about, psilocybin and all of those different things, psilocybin. And I just feel like there's a lot of really good things on the way.
Technology is something that has been a hot topic and across many different industries. When it comes to your field, what do you see could be happening in the next 5 to 10 years with all the technology booming that we're seeing currently?
Are you talking about AI?
Yeah.
I think everybody's a little bit nervous that AI is going to take all our jobs, but I don't think, I think AI is helpful for lots of different things. I don't know that it's ever going to take away that human connection though. And when I think about, I mean, people are already using AI for counseling. There's, I have friends that are like, look what they've named their AI person that they talk to every day, which is a little bit worrisome, because I think that kind of that means that people are going to become more introverted within themselves, and the depression can actually get a lot worse. I think that it can be helpful in a lot of ways when, like you said, when people are feeling stuck and they are feeling that alone, but then we need to take that next step, right? We need to take that, there needs to be that human connection, because even when we were doing just remote because of COVID, the difference in remote is helpful, but the difference in the patients that I was only seeing remote versus the patients that I see in person, and that human connection, it really is so valuable in the field of psychology and psychiatry, because we're social beings, and being alone when you're feeling depressed can be dangerous.
And speaking of dangerous, my follow-up question would be in thinking how AI is being something that is uniquely being positioned to be used as a tool or resource, additional tool or resource. What are some dangers, though, that you see potentially can happen if a patient wants to do it on their own versus an establishment like yours will have more responsibility in how they use tools like AI?
I think it's because people aren't, black and white. There's so much going on within them. There's so much, like when we should talking about a few minutes ago, talking about that relationship piece, and talking about how I might know that Joe Schmo is upset because I know that this thing is happening in 2 weeks that they're not necessarily thinking about. And I might not make a decision based on, that fact, or I might know that within their family history, because, we've really talked about different things, that this medication is actually not a really great choice for them, and it's going to put them at higher risk for something else. I mean, people are so multifaceted. So although the science, AI is cool, and there's lots of cool things that, it can do, treating a human being makes me really, really nervous. I know that there's a lot of, even when I'm doing trainings and we look at just books, right, from certain people. If we go by, if you see these symptoms, you diagnose them with this or you treat them with this, 9 times out of 10, I'm not doing that because it actually doesn't fit the patient. It's a good tool, but it doesn't actually make sense for that person. And so that's what makes me nervous, is that maybe they'll get okay care, but they're definitely not going to get the best care for them as a unique individual.
And with that, be a good segue to what we were talking about earlier, and that's the importance of community. When you look at how people use their friends and family and their support systems, how, and speaking of the human soul, how does those resources play a role as they are getting better with your services?
Oh, it's so important. We focus on the community, and I think in any time any of your listeners are going for care, is that you really want to find like community and find your tribe. We have a tribe within Harmony. I call them all my Harmony family, and they know that, and every patient knows they're a part of the family. We do go to the movies together. I rented out a movie theater to watch the new Inside Out 2 movie last year. We do events. If we have providers who are like, I have this set of people who are kind of struggling with the same thing, and we know that they could use a skills group, so we develop a skill for them. And with that connection piece. So we're really, it's not just we're taking these groups and we run them every month, or it's finding out what our actual population of people is struggling with at the moment. And then we bring people together so they can feel comfortable being vulnerable, they can feel validated, but they can also get the skills they need to get better. So really, I like to think of it as people are kind of like walking into my home and spending time with their family, but getting better.
If someone listening or watching feels like they at times feel overwhelmed, maybe it's because they overthink or they're too worried about some things that they can't control. How does your team help calm that and kind of educate them further of getting beyond that way of thinking?
The relationship, love, empowerment, validation, validating that that's how they're feeling, and explaining to them also that that's what anxiety is. It's when things are not in our control, whether real, imagined, or perception, then that's what creates the anxiety. And helping them to understand what their brain is doing and why, and then helping us figure out how to take those layers off. But the education piece, for them to be able to understand why things are happening, sometimes that can be enough. That it's not that, there's this, terrible thing happening to their brain, but this is just how your brain's working. This is what your brain is doing right now. And we talk about brain style a lot. Everyone has a different brain style, but that education piece is massively helpful.
That's a good teaser. So if our listeners or watchers are hearing that point right there, if you, real quick, we have a little time left, what are some different brain styles?
Oh, so neurodiversity is huge right now. We're talking a lot about how after COVID, people were really, really struggling, to connect with people, obviously. And there was a lot less masking, if you're in any sort of neurodiversity, whether it's ADHD, autism level 1, different types of, neurospiciness, there was a big chunk of time where people didn't necessarily learn how to mask. And I kind of find it beautiful, even though it can be more of a struggle for people. If you do understand a little bit more about your brain style and you can embrace it, it's beautiful. I mean, our neurodiverse population had the ability to become themselves without having that pressure. So it is definitely it's a little bit of a shift in the thinking about it. I think that they are some of the people who are neurodiverse, again, falling underneath the spectrum somewhere. They are our innovators, they're our entrepreneurs, they are our engineers, and they're able to be a little bit more of their true self now. But with that can come struggles with integrating back into, a typical classroom or a typical work setting. So we're definitely seeing that a little bit more. I would say that is probably the brain style, if you will. And there's so many brain styles within that brain style that is most prominent right now.
Once again, listen to Refocused Radio, watching us online, talking to our guest today, Dr. Rhonda Hodge, founder of Harmony Psychiatric Services. Go to their website, harmonypsychiatric.com. My last question for you before we take off is, if you could leave one thought or just leave something that's one truth about mental health to our audience, what would that be?
It's a good question. I'd probably say lean into yourself. And if you need support in leaning into yourself, grab it, hold it, embrace it. There are people there that are going to love on you and help you to become your truest self. A lot of mental health, has to do with us not feeling comfortable within our own skin and being ourselves and embracing ourselves. So I would say it's probably lean into yourself.
Like I always want to say to our guest, Dr. Rhonda Hodge, thank you for your time.
Thank you so much. I appreciate it.